Hello my nursing friends, how are you? Hope you are doing well. In this series we are discussing about emergency drugs. We have already covered adrenaline, noradrenaline, dopamine, dobutamine. If you have not watched my previous video, please go and you can see in my description box. We have already learned about drugs per minute calculation. So today we will be discussing about the maximum dose calculation for inotropic drugs. So our today's topic is max calculation. I want to welcome you all to my channel Nursing Made Easy with Titil. So max calculation of a drugs depends on many factors. First, depends on drugs, depends on doses, depends on concentration, and very important, depends on the patient condition and patient body weight. Let's start with the max formula. mcg per kg per minute. Formula is ml into concentration divided by body weight into 60. Now, how to calculate the concentration? The concentration formula is mg into 1000 divided by total volume. So, in concentration, this mg we are converting in mcg, like mcg. This 60 is referring the minutes and kg, the body weight, will be calculating according to that. Let's start with the drug Dobutamine. So, injection dopamine 1 ml contains 5 ml. 5 ml is equal to 1 ampule is equal to 5 ml. 5 ml is equal to 200 mg. Let's calculate the concentration. To calculate the concentration, we should know how to dilute dopamine. For dilution, we will take 1 ampule means 5 ml of dopamine plus 45 ml of NS or 5% dextrose. So total it will be 50 ml. Concentration is mg, that means 200 mg into 1000 divided by total volume, that is 54. So concentration of dopamine in 50 ml of dilution, it is 4000. So we will use this 4000 in our max formula. So after dilution, when we know the concentration of dopamine, now our advice is to start dopamine 5 ml per hour. So what is the max dose for that? ml, that is 5 into concentration 4000, body weight, let's assume 60 and 60. Okay, so that is 23, 10, 3. 90 by 50. It will come around 6.6 mcg per kg per minute. Okay. So now again we need to titrate the dose, and now we will reduce the dose dopamine as per 3 ml per hour So let's calculate that max calculation. What is the maximum dose for that? Okay, so now it is reduced 3 into concentration 4000 divided by 60 into 60. It will come around 3.3 mcg per kg per minute is the maximum dose if we start the dopamine as 3 ml per hour. Okay, let's assume for dopamine we got the advice in max, like doctor advise you to start 3 mcg per kg per minute dose. So formula will be the same. Now in that cases we know the max, that is 3. We need to know the ml, so we'll assume it is x. Concentration is same. We have already diluted the drugs. Body weight is 60 into 60. So the x is equal to 3 ml per hour. Okay. Let's take, as instead of dopamine, we will go for dobutamine. So let's assume we will take our next drug, that is dobutamine. Dobutamine 1 ampoule contains 5 ml and 5 ml is equal to 250 mg. So concentration will be 250 into 1000 divided by 50. So tell me how the 50 comes. So 50 is the total volume, 5 ml of dobutamine plus 45 ml of normal saline or 5% dextrose, anything you can use, that became 50. This is our 50 total volume. 5 concentration is 5000 for this dilution. We'll use this 5000 concentration to calculate the maximum dose for dobutamine. Let's assume our doctor has advised to start the dobutamine 5 ml per hour. Now we have to calculate the maximum dose for dobutamine. So formula 5 into concentration 5000, body weight, let's assume it is 50 to make the calculation more easy. It is 25 by 3, it will come at around 8.3 mcg per kg per minute. Same, if you titrate the dose, if you increase the dose, you can change the total volume over there. If you're increasing like 10, 15, change over there and you can use the calculator to use the max calculation. Okay, next we will take the drug noradrenaline. Noradrenaline 1 ampoule contains 2 ml. 2 ml is equal to 4 mg. 1 ampoule is equal to 2 ml is equal to 4 mg. Norad we can dilute single dose or double strength. First we will discuss the single strength. So for single strength dilution, we will take 2 ampoule of norad, that means 4 ml of norad, it will come and 8 mg. For dilution, 4 ml norad plus 36 ml of NS or 5% dextrose. It will come 40 ml total. So in that cases, for single strength of NORAD dose, concentration will come like 8 mg into 1000 divided by 40. 200 will be the concentration for single strength NORAD dose. As I said, NORAD, if your patient is not hemodynamically stable, if BP is not increasing, in that cases you can use, or most of the cases in ICU, if patient is in post cardiac arrest scenario, you can use the double strength also. For double strength NORAD, you have to take 4 ampule, that means 8 ml, and dose is 16 mg. Concentration will be 16 into 1000 divided by, so 40, as I say, 8 ml of NORAD, and now I will take 32 ml of normal saline or 5% dextrose. So 400 would be the concentration for NORAD. For NORAD max calculation, it will be like same. If you are using single strain, the concentration as we calculated, it is 200. So NORAD 10 ml per hour I have to start. So it is 10 into concentration for single strain 200, body weight is 60, let's assume, and it is 60. 10, 10. So it will come like, so you can calculate 5 by 9. Okay. For double strength, again the strength will be changed in that cases. Let's assume it is 10 ml per hour again. So 10 into, for double strength, concentration will be 450. Let's assume the body weight, and it is 60. You can calculate 2, 3, 4 by 3 it will come. Okay. So this is the formula you should use to calculate the maximum dose of inotropic drugs. For adrenaline, we generally use 1 ampule for stat dose. 1 ampule is equal to 1 mg. Or for dilution, we can dilute according to the your ICU protocol. Okay. I hope you liked my video. Please give a thumbs up and subscribe my channel. Thank you.